After a very stimulating morning, we have a very stimulating afternoon planned. And I understand from our supporting staff that we have nearly 100 people um, that are enjoying this by web. So that's really good. So we're very pleased at that audience. And certainly, again, we want to just say how happy we are that all of you are here. We're moving into the third panel, which will be looking at the birth settings and health outcomes and really get into the state of the science. What do we know? And the moderator for this panel, also a member of the planning committee, is Holly Powell Kennedy. And Dr. Kennedy is the current president of the American College of Nurse Midwives and is the inaugural Helen Varney Professor of Midwifery at Yale University School of Nursing. So she will introduce the panel and moderate. Thank you, Holly.
Thank you, Dr. Hayes. First of all, I would just really like to commend the Institute of Medicine and the Kellogg Foundation for convening this workshop on looking at the evidence on birth settings. It's a very important piece of work to do, and for Ruth Lubick, who worked so hard to make sure that we were coming back to this after 30 years. So thank you so much. It's really a pleasure to moderate this panel today. You're going to be hearing from 4 outstanding researchers on evidence that is at the heart of this workshop, and that is what actually happens in the settings in which birth takes place. The first person I'm going to introduce is Professor Ellen Hodnett, and she is on the faculty of the University of Toronto. Her research program focuses on rigorous evaluation of forms of care for childbearing women and on the effects of the healthcare environment in health outcomes. Having known Professor Hodnett really only through her tremendous and extensive work with the Cochrane collaboration, which I think many of us are familiar with, it's been a pleasure to work with her as we've developed this panel. She will be presenting the Cochrane Review on alternative versus conventional institutional settings for birth. So please welcome Professor Hodnett.